The writing subtest of the Occupational English Test is designed to assess your ability to communicate effectively in written English in a healthcare setting. Like on the exam day, you will be given some case notes like this and you need to write a letter out of it. So the first thing you need to do is to go to the writing task at the end of the case notes and see what type of letter they are asking you to write. Like they are asking you to write a referral letter, or they are asking you to write a discharge letter, or they are asking you to write a transfer letter. There are basically three types of letters that are likely to come up on your exam day. It will be either a referral letter or an urgent referral letter. Both of the letters are referral letter, but they have just a minor difference in their structure. I will get to that in the later part of the video. The second one will be either a discharge letter, or the third one will be either a transfer letter. Referral letter will be from a general practitioner to a specialist doctor, or from general practitioner to emergency doctor. 90% of the time there comes a referral letter. Discharge letter will be from like a specialist to a general practitioner, or from emergency doctor or hospital or rehabilitation center to a general practitioner. It will be like a discharge letter, and the chances of coming the discharge letter on the exam will be like 9%, and 1% of the time there comes a transfer letter. Transfer letter will be like from a general practitioner to a general practitioner, from a specialist doctor to a specialist doctor, from hospital to a ward, or from emergency department to a ward. So the transfer letter always comes between different ranks that are at the same level. Let's talk about the structure of the letter. There is a fixed structure that you need to follow and keep that secretly in your head before writing a letter. So a normal structure goes like there will be like date at the top, followed by address. After that there will be like dear doctor, followed by regarding, and after that there will be like a purpose statement, followed by the purpose expanded. Then at the end there will be like a request, followed by the closing. So in all of the letters, like all of the four types of letters, referral, emergency referral, discharge and transfer letter, the top and bottom will be the same. The difference will be like on the purpose statement and on the purpose expanded. Now I'm giving you like three free templates for the purpose statement and purpose expanded, for the referral letter, for the discharge letter, and for the transfer letter. Here you go. Okay, so in the referral letter template, as you can see, the purpose statement goes like I'm writing to refer Mr. XYZ, comma, whose signs and symptoms are suggestive of or consistent with, comma, for further assessment and management. So this will be like your purpose statement. You can mold this statement according to the scenario. The patient is having different complaints that vary from scenario to scenario, but the purpose statement will stay the same like this. Like it has three parts. The first part will be like I'm writing to refer, followed by the comma. Then there will be like a second part that the patient is having something, comma, followed by for further assessment and management. So you just need to remember this phrase for the purpose statement. In any referral letter, in any urgent referral letter, you have to write this statement. Just you have to mold it according to the context of the case notes. And at the end of the referral letter template, the request statement goes like, in view of the above, comma, it would be greatly appreciated if you could take over his or her care. So this will be like the request statement, and followed by the closing. For the closing, you just need to write this line as, for any queries, comma, do not hesitate to contact me, and followed by like yours sincerely, comma, and you like leave two lines followed by doctor. If you look at the discharge letter template, the purpose statement goes like, I'm writing to update you regarding Mr. XYZ, comma, who was admitted on whatever the date mentioned on the case note and treated for whatever the condition that patient is having, and is now ready to be discharged, comma, for further follow-up at your clinic. Now you look at the transfer letter template. The purpose statement goes like, I'm writing to update you regarding Mr. XYZ, comma, who was admitted on whatever the date and treated for whatever the condition, and is now ready to be transferred. You just change the word from discharged to transferred, comma, for further management under your care. So these three basically are the purpose statement for a referral letter, for a discharge letter, for a transfer letter. And if you pay close attention, the purpose statement for a discharge letter and transfer letter is exactly the same. There is just change of word from discharge to transfer. So you just need to memorize these statements, and you can easily write the purpose statement perfectly according to whatever the case note and whatever the scenario you'll be having on your exam day. We are left with the purpose expanded thing. Now what I'm gonna do is, there are some techniques, there are some formats, and there are some rules that you need to follow and you need to memorize before writing the purpose expanded thing. And I'm going to write all of that formats and those rules on the screen, and after that, keeping in mind all of these things, we will write three letters. We will construct three letters from the ground by having the case notes in front of us. One will be like a referral letter, one will be like an urgent referral letter, and third will be like a discharge letter. The first thing you need to keep in mind is what is the pattern of a normal referral letter. Like at the start there will be like a purpose statement, followed by personal, past, family history. After that there will come a first visit, followed by subsequent visits. After that the last visit, and at the end there will be closing. And what is the pattern of an urgent referral letter? Like at the start there will be like a purpose, followed by last visit, Then there will come the first visit followed by subsequent visits, and after that there will be like the personal, past, family history, and at the end there will be like the closing. After that you need to keep in mind how to write the sequence of a visit. Like at the start there will be like the presenting complaints followed by on examination, then there comes the radiology findings followed by blood test results. After that comes the prescription, you write about any advice, and at the end you write about investigations ordered if any. Then there are some formats that you need to keep in mind while you are writing about the labs or you are writing about the vitals, like his report showed HbA1c at 10%, or you can write as his report showed HbA1c level of 10%, or you can write his HbA1c was 10%. Same way you can write about the vitals as her blood pressure was 140/90, pulse was 110 and respiratory rate was 17. Or you can write it like her examination revealed blood pressure at 140/90, pulse at 110 and respiratory rate at 17. Or you can write it like she has a BP of 140/90, pulse of 100 and respiratory rate of 17. So these are just like the general format you need to keep in mind while writing about the purpose expanding section. Okay, so now comes the interesting part. Having all of this information in the mind, now we are going to construct a referral letter from the ground. There are some case notes on the screen. So the first thing you need to do is just go to the end of the case note and see what is the writing task. Using this information given in the case note, write a letter of referral to Dr. F. Shaw, 201 Albert Street, South Coddington. And you just can go through like 1 or 2 lines above the writing task, like there is a plan mentioned as refer to pediatrician Dr. F. Shaw, and the assessment is post-streptococcal nephritis with early renal failure. So just reading this section, you have a basic idea in the mind that you need to write a referral letter to like a pediatrician whose name is Dr. F. Shaw. And if you are referring a patient to a pediatrician, it means the patient is like a child. So you just got this idea in your mind. Now we are going to start constructing a letter. So the first thing you need to do is to write the date at the top of the page on the left side. Most of the time you write the date on the letter that is of your exam day, that you are taking the exam on what date. You need to write that date on the referral letter, or most of the time they mention in the case note that use this date to write the letter. So like in this case note they did not mention any date. So what we need to do is to just go to the case notes and see how many dates are mentioned on the case note. Like you can see there is a date mentioned as 25 February 2014. After that there is a date mentioned as 18th March 2014, followed by the third date as 20th of March 2014. So you just got the idea that the patient came to the general practitioner 3 times and the last visit was on 20th of March 2014, and at that visit you assess that the patient is having some serious problem and you're going to refer that patient to a specialist. So you will write that date on your referral letter, that at that date you assume that the patient need to go to a specialist. So you will write the date like 2014, and the correct format to write the date is that you will use double digits for the days and for the month. Like it is 20th, you write 20 slash followed by March is 3. You will not write only 3, you will write 03 because you need to use 2 digits, followed by the year, that is 2014. So this is the correct way to write the date. You just need to memorize it. There are a lot of different ways to write the date, but you just need to memorize one, because if you remember all of the different formats you will confuse yourself and you will make a mistake. You don't afford to make a mistake in writing the date. So just memorize that you need to write first of all days followed by month and followed by the year, and you used to use double digits on writing the date. So after that you need to write Dr. F. Shaw. And how you know that you are writing a referral letter to Dr. F. Shaw, that is mentioned in the writing task. So you will write exact same spellings that are mentioned in the writing task, Dr. F. Shaw, and there is a comma after that. So there is a basic rule that applies in the writing task, that whatever is written and they put a comma there, it means the next word will come in the next line. So when you write Dr. F. Shaw, there is a comma there, that means whatever you need to write next will come in the next line. So Dr. F. Shaw is a pediatrician. We came to know about that he is a pediatrician, that is mentioned in the plan. So what we will do in the next line, we will write pediatrician, and we will write P for the pediatrician in the capital letter. After that we will write the address, and the address is 201 Albert Street. You need to write the exact same spellings that is mentioned in the writing task. You cannot afford to make mistake in that. So 201 Albert Street, there is a comma there. That means you need to write the next word in the next line. So the next line will go like South Coddington, exactly the same. So that way you just completed the date and you just completed the address in the correct format. Next we will write the Dear Doctor. So in the Dear Doctor section we will write as Dear Dr. Shaw. We will not use F dot because it is just a general rule that when you are addressing an adult or a patient or a doctor, we will use just the last name, and the last name is Shaw. If there is a patient who is less than 12 years of age, like the boy, we will use the first name. So we just need to remember that in this section. So we will write Dear Dr. Shaw, comma. Next we will write the regarding statement. For the regarding statement we will write R small e followed by colon, and after that we will write the name of the patient, comma, followed by whatever years of age. So in the case note we can see that there is a mention that Relay Precious is a patient in your general practitioner. He is 4 years old, boy accompanied by his father. So we got the name of the patient. The name of the patient is Relay Precious. So in the regarding statement we will write the complete name of the patient, either he is an adult or is a child. We write the complete name, and when we came down in the purpose expanded section we will just use the first name if the patient is like less than 12 years of age, and we will use the last name of the patient if he is or she is an adult. So we will write here like Really Precious, comma, 4 years of age. Whatever the age of the patient, like 4 years, 15 years, 20 years, you will write 15 years of age, 20 years of age. Again, there are a lot of different formats to write in this section, but just memorize one so that you will not confuse yourself or make a mistake. Next, we will write the purpose statement, and I have already given you the free template to write the purpose statement. So we will write the purpose statement as I'm writing to refer Relay. We will not use Precious here because we need to save words, and our letter will be like 180 to 200 words. So we have already mentioned the complete name in the regarding statement. We do not need to write the complete name in the purpose statement. I'm writing to refer Relay, comma, whose features are consistent with post-streptococcal nephritis. Here is one thing you need to remember. When you come to the case note, at the end there is like assessment thing. And in the assessment thing, the general practitioner assesses that the patient is having post-streptococcal nephritis with early renal failure. And after the renal failure, there is no question mark or there is nothing mentioned here. It means that the general practitioner is confident that the patient is having this problem. If there is like a question mark here, it means that the general practitioner is not sure of the condition the patient is having. In that case, we will use the word suggestive of. But in this scenario, the doctor is confirmed that the patient is having this problem. So we will use the word consistent with. So I am writing to refer Relay, comma, whose features are consistent with post-streptococcal nephritis with early renal failure, comma, and after that we will write for further assessment and management according to that template. So we have successfully completed the purpose statement. Now we will come to the purpose expanded thing. As we can see, it is a normal referral letter. So the format we need to follow is purpose followed by past, family, personal history followed by the first visit. After that there comes the subsequent visit followed by the last visit, and at the end there will be the closing. So in the case notes we can see that there is no mention of the past or personal or family history. It means they made the task easy for us so that we don't need to write that thing. So we'll start with the first visit, that is on 25th of February 2014. And how to write a visit, I give you a template for that as well. First of all, you will write the presenting complaint followed by the examination, followed by any radiological finding, followed by any blood test, then followed by the prescription, followed by the advice, and at the end you will write any investigations that were ordered. So we will write like on 25 to 2014, comma, Relay presented with the complaint of fever, sore throat and husky voice. So we started with the presenting complaints as that was in the sequence, and we transferred his complaint as sore throat, husky voice and febrile or temperature 13 as a fever. After that we write the statement as on examination, comma, the tonsils were enlarged and exudative along with the tender enlarged cervical lymph nodes. So in this particular visit we covered the presenting complaint followed by the examination, but there were no mention of any radiological finding or any blood test. There is a mention of prescription we can see, but there is no mention of again any labs ordered were done. So we will write here like tonsillitis was suspected and penicillin was given according to the format there. Successfully we have completed our first visit. Now we will come to the subsequent visit, visit, as that was in the format we have already in our mind. On subsequent visit, relay looked tired and lethargic, examination revealed that. One thing you need to remember is you need to keep changing words. In the above paragraph you write as on examination, in this paragraph you write examination revealed that. The meaning is same, but you are just changing the word, and changing the word in different paragraph is really crucial, so that the examiner is aware that you have a good command on the vocabulary. I will give you some other alternatives for the common words that we will be using in the letter construction, like you can write on examination, or you can write her examination or his examination revealed short. You can write presented, or you can write visited or reported. You can write on subsequent visit, or you can write on reviewed visit, or you can write on her next visit. And there are a lot of different words that I'm going to mention on the screen. You just take note of that. Now let's get back to constructing our letter. So examination revealed that there was a tonsillar hypertrophy, and urine analysis revealed macroscopic hematuria, These findings were suggestive of post-streptococcal nephritis or urinary tract infection. After that, he was advised to drink plenty of water, and relevant investigations were carried out to review in the next 2 days. So as you can see, you followed the same pattern in this paragraph as well. First we talk about the presenting complaints that were tired and lethargic, followed by the examination. After that, there were no radiological findings, but we mentioned about the blood tests that were done and the urinary tract infection. After that, there is no mention of prescription here, but the mention of advice. So we write about like he was advised to drink a plenty of water. After that, there is a mention of like the investigations that were carried out according to that pattern that investigations mentioned will be at the end. Now let's construct the third paragraph of our last visit. It will be the last thing of our purpose expanded thing. After that, we just need to write the request and the closing statement, and our first ever letter will be completed. So just quickly go through the case note and complete the purpose expanded thing. So we will write it as on 20/03/2014, relay seemed fine. So his asymptomatic thing, we just turned it to seemed fine because he's asymptomatic, and we start with the presenting complaint. Relay seemed fine. His blood pressure was a bit higher than previous visit, we covered the examination thing as well. Now we need to write about the radiological finding or blood test or any prescription and advice or the investigation. So we will write as labs report short elevated urea and creat and RBC cast in urine were of renal origin. We will not write about the thing which is normal because we need to save words, and these things were the major that were elevated, so we write about that in the purpose thing. So that's it, we have completed our third paragraph as well. Now we just need to write the request and the closing. To write the request, we will go back to our free template. It says that we will write it would be really appreciated if you could take him under your care. That's a perfect request. And now we will close the letter and we will write the closing statement as please do not hesitate to contact me if you have any queries. You just need to remember this line in whatever the closing you are having in a letter. You just write this line, it will be perfect. And at the end you will write on the left side yours sincerely, So there is one thing you need to remember. If you know the name of the doctor, that in this scenario you know the name that the doctor is Dr. F. Shaw, so you will write here as yours sincerely. But if you do not know the name of the doctor, like I will discuss in the next letter, like there is a letter to emergency doctor or ED doctor where you don't know the name, you will write here as yours faithfully, So these are the only two scenarios you need to remember. If you know the name of the doctor, you will write yours sincerely, If you do not know the name of the doctor, you will write yours faithfully, After that you will leave two lines and you will write doctor dot on the left side. So this way you have completed your first ever letter. And if we look at the marking of this letter, you got like 360 out of 500. So not bad. It is your first ever letter and you just learned some rules in this letter as well. By keeping in mind the things we just learned, let's construct another letter. So we have a case notes here. By quickly going through the case note, we can see that there is a heading of patient history, then there is a visit on 10th of September 2014, followed by another visit on 12th of September 2014, and after that there is a third visit on 15th of September 2014. And we quickly go to the writing task. They mentions using the information given in the case note, write a letter of referral to the admitting officer at the emergency department, Newton Hospital. So by looking at the writing task, we can see that we need to write a letter to the emergency department, so that there must be some emergency. So it's kind of an emergency referral letter. So by establishing the idea that we need to write the emergency referral letter, the first thing we need to come in our mind is the sequence we just remembered. So that in the emergency referral letter, we need to write like the sequence is first the purpose statement, followed by the last visit, followed by the first visit, then subsequent visit, and followed by the past personal family history, and at the end the closing. So that thing we need to keep in mind while constructing this letter. First of all, we will write the date. So in the case note, we can see that there is no mention of that date, that you need to write the letter on this date. So we will use the last visit date, that is on 15th of September 2014. We will write as 15/09/2014. That's the exact format of the date we just established. After that, we will write the admitting officer, because in the case notes we can see that they are asking us to write a letter to the admitting officer. So the admitting officer, we mentioned that. After that, we will write the emergency department. After that, there is a comma. So the rule that whatever comes after the comma we will write in the next line. So we will write Newton Hospital in the next line. After that, there will be the dear doctor statement, and in this case we will not know the name of the doctor. So what we will write, if we don't know the name, we will write dear sir. If we know the name of the doctor, we will write dear Dr. Shaw or dear doctor, or whatever the name the doctor has. But here we don't know the name, we just need to write the letter to the admitting officer. So we will write dear sir, comma. So we have done that. After that, we will write the regarding statement. So the regarding statement are small e colon and Miss McConville, comma, 38 years of age. So in the case note, we can see that the name of the patient is Sally McConville, and I already told you that if there is an adult patient, we need to write the last name, and we will use Miss or Mr. Before that. So we just simply write Miss McConville, comma, and the age is 38. We will write 38 years of age. Next, we will write the purpose statement, and we have that purpose statement template for the referral letter in our mind, that we will write here like, I am writing to refer Miss McConville, comma. Those features are suggestive of. So first we cross check that either the general practitioner is confirmed about the diagnosis or not. So we can see that there is a question mark before the pneumonia, so that the doctor is not confirmed about his diagnosis. So we will use the word suggestive of. So we will write here as, those features are suggestive of pneumonia under your care, comma, for further management. This way we have completed our purpose statement by keeping in mind the free template I just provided you earlier. Now we will write the purpose expanded thing, and to write that thing we already have a thing in our mind that we will use the sequence as, first we will mention the last visit, after that the first visit, then subsequent visit, and at the end we will write any personal or history, followed by the closing. So by keeping that framework in mind, we will write about the last visit. If you look at the case of the last visit, it goes like, history has more shortness of breath today despite prednisolone and antibiotics, feeling feverish and unwell. Examination, short of breath at rest, respiratory rate, blah blah blah, and we have all of the information regarding that. So now we will going to construct that in the form of a paragraph by having a normal idea that how to construct a paragraph. By first you write the presenting complaint, followed by examination, followed by any radiological finding, followed by the blood test, all of the framework I already told you. So we will write here as, on 15/09/2014, comma, Miss McConville presented with worsening shortness of breath despite taking prednisolone and antibiotics. Now we will write about the examination. Examination revealed that she had fever, tachypnea with obvious use of accessory muscles. So we just converted those information in the examination section into a statement. There was a widespread wheeze with bilateral basal crepitations, acute exacerbation of asthma was suspected, and a provisional diagnosis of pneumonia was made. She was prescribed a Ventolin inhaler, however her condition did not improve. So you can see that whoever wrote at the first he used the word but we need to use however. So there are some rules about the English grammar that you need to remember. I will provide a PDF to all of the grammar rules. There are like 100 rules. Just you need to go through that PDF once and you will memorize all of those rules. The rule that if there is a patient less than 12 years of age, you use the first name. If the adult, you use the last name. This rule is also mentioned there. So there are a lot of rules. Whatever the rules you need to know to write a letter, they will be mentioned in that PDF. So you just quickly go through that once after this video and you will be good to go. Now let's construct the second paragraph. That will be our first visit. So on 10/9/2014, Miss McConville first presented with a complaint of runny nose over the last 2 days, fever and productive cough. So whoever wrote at the first runny nose for 2 days. There is some grammar rule involved here that you need to write over the last 2 days if there is some indefinite period of time, not for 2 days. So by going through that grammar rule PDF, you can easily get that mistake correct. After that, examination revealed a scattered wheeze on the chest and inflamed throat. A viral respiratory tract infection or infective exacerbation of asthma was suspected. She was prescribed Ventolin inhaler and continued fluticasone. There is another mistake mentioned that you use small words in the start for a generic name of the medication. Fluticasone is a generic name, so you use small f. As her asthma was previously well controlled on it, we have successfully constructed the paragraph for our first visit. Now just quickly go to the subsequent visit. The next visit we have is on 12th of September. We can either write the next paragraph as on 12/9/2014 or we can write as on subsequent visit. Both of the things will be correct. So we write here as on subsequent visit, Miss McConville. Here you can see that mention presented corrected by attended. So we need to keep in mind that we need to keep changing words. I already gave you a list of different alternative words. Here we will write Miss McConville attended with increasing shortness of breath and dyspnea on minimal exertion. This will be the presenting complaint in the start. On examination, there was a widespread wheeze. However, no crepitations. After that, infective exacerbation of asthma was suspected and she was prescribed amoxicillin and prednisolone. Again, amoxicillin is a generic name. We will use the small letter as A. So this way we have successfully constructed the paragraph for our subsequent visit. We will write the past personal history in the paragraph like Miss McConville has a past medical history of asthma and hypertension. She has been taking gamipril, paroxetine, fluticasone and Ventolin with no allergies. So that's the best possible way we can concise the information that is mentioned in the case notes. Now we just need to write the request and to close the letter. In the request we will write as it would be appreciated if you could take Miss McConville under your care. The request is like that, and the closing statement will go like please do not hesitate to contact me if you have any queries. After that you see that there is mentioned yours faithfully. As I already told you, if you know the name of the doctor you write yours sincerely. If you don't know, like the admitting officer, we don't know the name of the doctor, we will write yours faithfully, and then you will skip 2 lines and you will write doctor. This way you have successfully constructed another urgent referral letter as well. Now we will construct a discharge letter. After that you just need to go through the grammar rule PDF that is linked in the description and you just try to construct your own letters. You just need to do the practice on your own by having the case note in front of you and going through the case note and constructing the letter by converting those case notes in a form of words by having the grammar rules in mind, keeping the free templates and the sequence I already provided you in this video. You can easily write the perfect letter for the OET exam. Okay, so now let's just look at another case note. You are an endocrinologist working at Newtown Community Hospital. Your patient is being discharged today to her local GB clinic for further case management. You quickly go to the case notes below. Using this information given in the case note, write a letter of discharge to Dr. Anna Solar, General Practitioner, Newtown Community Health Center. Information are about her patient condition and your medical recommendation of her discharge. Address your letter to Dr. Solar, GP, Newtown Community Health Center, Newtown. By looking at this case notes, you can see that you're going to write a discharge letter. So the first thing you need to bring in your mind is the free discharge letter template that I just provided you. So by looking at the template, we can see that after writing the purpose statement, we need to write when the patient was admitted in the hospital stay and the nursing management should be mentioned briefly. And after that, we will write as in view of the above, it would be greatly appreciated if you could, and there we need to mention the plan. So in our discharge letter, the plan is the main thing that we need to write, and we need to write everything that is mentioned in the plan, including any drugs, any dosage that is mentioned in the plan. And we will not write any personal or past history of the patient in a discharge letter. By looking at this template, we have an idea in mind that how we will structure our letter. So now we come to the case note. We can see that in the start there is like a family background paragraph mentioned. They just put there just to confuse us. They want to know that if we are aware of the fact that we don't need to write any personal history in our discharge letter. So having the case notes in front of us, let's construct the discharge letter. So the first thing we need to write is the date. So in the case note we can see that the patient was discharged on 15th of July 2017. So we will write this date on the discharge letter. We will write the date as 15/07/2017 because we need to write in the double digits. After that we will skip one line and we will write Dr. Anna Solar. That is the name of the doctor we are writing, and that is mentioned exact in the writing task. After that there is a comma and there is GP. So we need to write the full word for the GP, that is general practitioner, and there is a comma after GP, and there is Newtown Community Health Center. We will write this whole word in the next line as Newtown Community Health Center, and there is a comma after that. So that means we will write the next word in the next line, and the next word is Newtown. So we will write Newtown in the next line. So we have successfully write the date and the address. Next we need to write the dear doctor. So we will write as dear doctor. The name of the doctor is Anna Solar. So we will use the last name as Dear Dr. Solar. As I already mentioned you about a rule that we need to use the last name for the adult or any patient or a doctor, but the first name for a child less than 12 years of age. So we have write as Dear Dr. Solar, comma. Next we will skip one line and next we will write the regarding. So it is regarding the patient. The name of the patient is Miss Mary Bell. So we will use the last name as Miss Bell, and there will be a comma after that, and the age of the patient is 66 years. So we will write as Miss Bell, comma 66 years of age. So we have successfully constructed the regarding patient statement as well. Now we will write the purpose statement, and to write the purpose statement we need to keep in mind the free template. So we will write here as I'm writing to update you regarding Miss Bell, comma, who was admitted on the date is mentioned in the case notes as 24th of June 2017. So we will write here as I'm writing to update you regarding Miss Bell, who was admitted on 24th 06/2017 and treated for a small infected left foot ulcer secondary to uncontrolled diabetes mellitus type 2. And how we know the patient was admitted for this condition, we will go through the case notes in detail. In the case note we can see that the patient diagnosis was unstable diabetes mellitus small infected left foot ulcer. So by having some background knowledge in our mind that if a patient has uncontrolled diabetes mellitus, it can lead to the infected foot ulcer. So we have just turned this diagnosis into a statement that it was the reason the patient was admitted at the first place and is now ready to be discharged under your care. So we have write the two parts of the purpose statement, and after comma we will write for further follow-up. So here we need to remember one thing, that when we are writing a discharge letter, we will write at the end for further follow-up, not for further management, because when a specialist discharge a patient, the patient go for a follow-up to a general practitioner. So this is something we need to keep in mind. We will write like a further follow-up whenever we write a discharge letter, but when we are writing a referral letter or a transfer letter, we will write as for further assessment or for further management. So this way, by keeping in mind the template, we have successfully write the purpose statement. Now we will write the purpose expanded thing by having the template in mind, and we will start constructing it like on 20/07/2017, comma, Miss Bell was admitted due to small infected left foot ulcers secondary to uncontrolled diabetes mellitus type 2 dot. So we write the statement like that. After that we write the line about the examination of the patient. We have that framework in our mind that we need to write the presenting complaint followed by the examination, or all of the different things. So to write the fasting blood sugar level, blood pressure, I already gave you the format how to write these things. So by following that format, we completed this sentence. Her fasting blood sugar was in 12 plus range, blood sugar random was in 7 to 8 range, and blood pressure was at 130/80. Now we will move on and we will write as she was given levanclamide, which would be continued, and augmentin due forth, which would be reviewed after completion of its course. And how we write this line is when we go to the case notes and we study the case notes in detail, we can see that the management and progress of the patient was She was medically hyperglycemic. Agent was given like glibenclamide to continue. Antibiotic therapy augmented due for review at completion. So by keeping in mind the template, we have an idea that first we need to write the statement as the patient was admitted because of what of the problem, and after that we need to write the hospital stay and the nursing management briefly. And the hospital stay and nursing management included these three things: that the patient was given glibenclamide and antibiotic therapy was given, that includes augmented due fourth. So by keeping in mind the sequence, we just converted these case notes into the statements like that. Next we will write a line about the nursing management, and we mentioned as here daily dressing of ulcer with saline was done and the ulcer was observed for wound margins, healing and any complication. So this line signifies the nursing management of the patient. So as you can see in this paragraph, we have successfully constructed how the patient presented in the hospital, followed by the examination, what was the blood pressure and all of the different parameters at that time. After that we wrote a line about the initial management in the hospital that includes the medications and some antibiotics, followed by the small brief explanation of the nursing management that include the saline dressing and all of that. Next we need to write the management plan, and we will write the management plan in the next line. So when we go to the case note, we can see that in the discharge plan they say monitor medication compliance, blood sugar level, alcohol intake and diet. So we need to write like something about the management regarding all of these things. After that we need to write some encourage moderate exercise program, encourage establishment of social activities, may request metformin dosage lowering if side effects occur. So we can see that there are four different things we need to write in the discharge plan, and we will go on writing it as in view of the above, I would appreciate if you could watch for Miss Bell's medication compliance and blood sugar levels. Advise her to do moderate exercise, decrease her alcohol intake, take part in social activities and take a good diet. Please adjust the doses of metformin if side effects occur. So in this small paragraph we have successfully written down all of the discharge plan that was given. As the discharge plan is very important, we need to write everything that is mentioned in the discharge plan. So that's pretty much it. We are almost done with our letter. We just need to write the closing and our letter will be complete. So in the discharge letter, as we can see that the request and the plan go together. So in the plan statement we have already covered the request as well, because you are giving the plan that is you are requesting at the first place. So the request is already covered in it. So we just need to write the closing, and it goes like, please do not hesitate to contact me if you have any queries. This is the universal line we have applied in the two letters before. So after that, yours sincerely, we know the name of the doctors. So we mention here as yours sincerely, and you will skip two lines and at the end you will write doctor. And if you can see that this letter got like 420 marks out of 500, and we made a pretty good progress here. So now as you can see how easy it is to write a letter. You just need to have some templates in your mind. You need to have some rules that you need to follow, and by a little bit of practice and applying all of these techniques and strategies that I shared with you, you can easily write a letter. So what you need to do now is that I will share a link in the video description that will contain like 10 to 15 corrected letters. Like I discussed with you 3 letters here, there will be like 10 to 15 letters. You just need to read all of those 10 to 15 letters and you see what are the mistakes there in those letters, and you try to not do that mistakes. And the PDF that contain the 100 grammar rules, you just need to read all of those grammar rules and try to write letters in your own paper. You just need to go through the practice to see the case notes and to construct a letter out of that. So I will give like 10 case notes in the description as well. That 10 case note, like there will be case note for 10 letters. So you just open up that case note and try to construct your own letter, having the free templates, having the rules, grammars in your mind. And like after constructing or writing 5 letters or 5 to 10 letters, depending upon your baseline English writing skills, you can easily pass the OET writing subtest by writing a very wonderful letter.